So you've been diagnosed with vertigo, or the spins is what we sometimes call it. Here's what you need to know and a bit of what you might like to know. So vertigo is actually usually caused by a problem with your inner ear. By vertigo, I mean it seems like the room seems to be spinning on you or moving relative to you. It's sort of like motion sickness. And this can be very debilitating because when you start to feel like the room is moving on you, it makes you feel very, very ill. And I see about one patient a shift who comes in with peripheral vertigo, peripheral meaning in your ear, in your inner ear, and they are vomiting like crazy because their room is spinning and they feel terrible, and they are very frightened by the fact that they're vomiting. But that doesn't surprise me, because if you went on a very rough ship at seas, you would also vomit profusely. That's a normal reaction when you can't figure out where you are in space. And the reason that's happened, we think, is because there's inflammation in your inner ear. Usually you're fighting off a cold. Many patients describe having a cold within the last week. Or you're fighting off a cold and doing it successfully and don't even know that you're fighting off a cold, but the inner ear gets some inflammation happening, and your inner ear normally works with your eyes to figure out where you are in space. Now, if the inner ear is inflamed, it can't do its job, and now your eyes are seeing things, but you don't know where you are in space, and hence the spinning happens. And then when the spinning happens, patients usually vomit profusely. There's not any treatment for vertigo, unfortunately. The good news is it goes away on its own, usually in 1 to 2 weeks, hopefully earlier if you're lucky, in a couple of days. Do get a lot of sleep, and most importantly, move very slowly. If you turn your head suddenly, or you get up from seated, or even worse from lying down once you've woken up in the morning, you will set it off and you will get terrible spins and start vomiting. So you want to move very slowly. You want to move your shoulders with your head and not turn your head suddenly, and just be very careful and get lots of sleep. Now, if it's very bad, you can try a prescription medication called Circ, but it's not very effective. To be quite honest, it just makes people sleepy, and they sleep more. But does it actually help with the spins or the vertigo? Maybe, maybe not. You can try it, and maybe for you it works, and if that's the case, great. Maybe worth a shot if you're having a lot of symptoms and having a difficult time with it. Reasons to come back to the emergency room would include changes in your vision, weakness in one arm or one leg on one side of your body, or one half of your face isn't working properly, a new headache or confusion, or getting very sleepy or drowsy. More concerning to me than the severe vertigo and the vomiting is a very mild vertigo or spinning. It's not too bad. It's going on all the time. It never seems to go away or suddenly come on. It's just there every day, day after day. That's a reason to come into the emergency room or see your family doctor right away. But the severe vertigo that's causing the vomiting, that's in your inner ear, and it should go away on its own. Again, watch out for changes in vision, weakness in your arm or face, a headache, confusion, or feeling more drowsy than usual. Those are reasons to come back to the emergency room. I'm Dr. Atzma, and those are my discharge instructions for peripheral vertigo or the spins.